Podcast. I'm your host, Dr. Spencer Nadolsky, and with me today we have the awesome Morgan Skinner. She's a nurse practitioner who works in the ER, but also deals with obesity and obesity medicine herself as a patient and with her own patients. So, welcome, Morgan.
Thank you very much for having me today.
Yeah, you have a pretty fun TikTok. You're kind of a social media light like myself, and
Thanks.
you advocate for those with obesity and also just weight in general and stigma and bias. And I love following your stuff. So thanks
Thank
for
you.
coming on,
Yeah,
and
thank you.
thanks for doing that too.
Yeah, absolutely. No, I think it's super important to have people out there that are advocating for that have been through it because I think we have a little bit of an extra light to shed.
Yeah, I want to hear. I kind of want to hear like if you've had any experience with bias and stigma towards yourself, and then like I know you have patient stories
Mhm.
as
Yeah.
well.
Yeah, I could write a book honestly about not only the stigma just with myself, but with being a nurse and being a nurse practitioner. Me personally, I was diagnosed with Hashimoto's when I was 12.
Mm.
And as you know, that can lead to, your body's kind of slowing down. It can lead to gaining weight and just being really fatigued and tired. And I remember being a 12-year-old and just being told that I was a fat kid. That's what the
Mm.
doctor said was just count your calories. So I remember being 12, counting my calories in this little tiny book, and it's like I'm in junior high. And
Oh.
then finally, I found a really good doc that was like, no, you have a disease. You have a disease. You went from being a very healthy, active child to barely being able to get out of bed. So it started in childhood, unfortunately, and it really has continued. And that kind of was a driving force for me to get into medicine just because I didn't ever want my patients to feel so disgusted with themselves that they couldn't reach out for help because I see it in the emergency room now. I see it with my patients now that don't want to go to the doctor because they think that their genuine concern is going to be blamed on their weight. And so
Hmm.
they're worried about that bias and that judgment. So they don't get care at all. And they wait until it's too late and say they have, you know, a ruptured appendix or gallbladder
Oh.
disease or kidney disease, and they're in agonizing pain, but they don't want to come in because they're worried that it's going to be blamed on their weight because it has in the past.
Yeah. What's the most like egregious thing you've seen in the ER in that situation?
Oh gosh, I used to work specialized in cardiac medicine, and so we would get it all the time where we would have patients that would have cardiac complaints. And I had a patient with an aortic aneurysm that was actively rupturing, and he was told it was GERD from being obese.
Wow. Oh gosh,
Yeah,
that's horrible. Did he
yeah.
survive?
He did, but it made me sick to my stomach that he felt like he couldn't come in with this kind of complaint because he was so used to it being blamed on his obesity, and then it was blamed on his obesity.
Oh my gosh. So, I mean, the classic example you always read about is back pain. Back pain. It's your weight.
Oh yeah.
It's your weight. And then they have a tumor in their spine. It's not common, but you have to look at the person in front of you and treat them as if all the differential diagnoses could be there.
Yeah,
That's
absolutely.
so sad. Oh, that's a. I'll have to add that one to when I kind of discuss this because
Yeah.
that's so sad. But I'm glad he's all right because like
Yeah.
yeah, I can only imagine it's your reflux from your weight. I'm no my
Mhm.
aorta is
My my
it's going to
body is
explode.
repairing itself. So yeah.
Oh my
And
gosh.
I just recently too had someone pretty young, which that stuck with me because I know what it's like to be young and overweight, and it's just blamed on your weight or, the fact that you're young. This patient was not that heavy set in the first place, overweight, absolutely. But this patient went to the emergency room, early 20s, was agonizing abdominal pain. And they sent him home and said that, oh, it's just weight. You had too much of a dinner. Your stomach is way too stretched. So you just need to go home and rest. So he turned around and came to my emergency department, and the patient was had gallstones, and
Wow.
he had a genuine concern, but was dismissed because of being overweight.
You just ate too much. No, it's
Yep.
gallstones. I have my gallbladder needs to be taken out.
You ate too
That's
much Taco Bell for dinner and you just need to go rest. Nope, your gallbladder is full of sludge and stones and you're sick.
Yeah, that's really sad. I mean, and you want to say that like, no, that could never happen. People say no way that would ever happen, but
Mhm.
you're literally telling the stories that you've seen with your own eyes. I've seen it. I can even hear when I don't work in the clinic anymore. It's all virtual, but when I was in the clinic, I could hear through our paper thin walls another clinician doing it to one of my patients because I was booked all day, and it's just like, well, come on, like
Right.
that's not really fair. So when people like, oh, they actually had a tumor, people are like that doesn't happen. It's like, no, that's what happens because they people put their blinders on.
Yeah,
Physicians, unfortunately, and
and
then you see it.
yeah, I think part of that too is in some cases, if you haven't gone through it yourself, it's harder to empathize with that because you
Yeah.
haven't gone through it. And so there are some amazing providers out there that advocate for, obese patients and treating the patient, like you said, treating the person in front of you. But I think patients do feel a little more comfortable opening up when they see a provider that is not, a size two.
Yeah, I have patients tell me they're like, "Oh, you're pretty intimidating." Luckily, because of my bedside manner and whatever, they eventually open up. But I can imagine like this guy doesn't struggle with his weight. He won't know anything that I'm talking about, and they've had such shame in the past from past providers that I don't blame them.
Right.
So yeah, that's great. So you can relate with patients. They come in with an
Hmm.
actual emergency issue. You
Yeah.
don't just blame it on their weight. You say, hey, let's actually evaluate you like
Hmm.
a good clinician would. So we're lucky to have you as a clinician in
Thank you.
out there in the world.
Thank you. Thank you.
Yeah. So what about your own journey with weight? So you talked about the Hashimoto's, and for
Mhm.
those listening, Hashimoto's autoimmune disease. Your body starts attacking your own thyroid. Your thyroid controls your metabolism, your metabolic rate, and all the little processes in your body.
Mhm.
I actually have Hashimoto's. Got it in medical school.
Oh,
I was
good.
like, I need to get evaluated for ADD. Everybody else is taking Adderall and
Yeah.
high out of their minds. And I'm like, I guess I need some Adderall because I don't know how to sit here for 30 minutes at a
Right.
time and looking. And so they're like, actually, you have Hashimoto's. I'm like, oh, that's why I'm so tired anyway.
That's
Kind of
why
an
you feel
interesting
out
thing.
of bed.
So you're 12, you get that. That's
Yeah.
debilitating, especially as a little kid who's, usually active and playing around. So you can't get out of bed. You're
Yeah.
tired. They're telling you you're just being lazy and eating too much or whatever. And finally you get some medicine. But then what about like after that? Like, could you go through some of that?
Yeah. So with Hashimoto's, even being on medication, it can still be difficult to lose weight. And then the older I got, I was diagnosed with PCOS on top of that. And so then
Mm,
I had two different disorders that are making it a little more difficult to lose weight. And so I was never a skinny child after that. I was when I was very, very young. And like I said, I was diagnosed at 12 and went from, playing soccer all summer to I can't get off the couch. And
mm,
so, I got my thyroid in check and I was able to build that energy and start feeling a little bit better. But then I had to start trying to reverse the damage that was done, because at that point I was absolutely an overweight child and an overweight teen, and so that weighs a lot on your mental health as well. You think that this is my fault. I've been doing everything wrong. And while, there are choices that are made that might not be the best in regards to weight loss, patients have an actual medical problem. And so, me having two medical problems, I started every single diet I could come up with. You name it, I tried it. Like I said, I was in junior high counting my calories in a massive calorie deficit. I would eat maybe 600 calories a day sometimes because that's what I thought was supposed to help and that's what was going to fix the problem. And so, even into my early and late 20s, where I'm at now, it was always still very difficult. And I would wake up every day with that food noise that we talk about so often, where it's like you're not obsessing over, oh, I need to eat this, I need to eat that. It's just that food noise of, I can't eat this, I can't eat that. You're always thinking about I need to watch this and I need to track this. And it's exhausting. And so after trying every single diet that I could and failing every single diet that I've done, I was personally looking into weight loss surgery,
Hmm.
which I think is a great option for some patients. But based on my BMI and my age, it was hard to find a doctor that was really willing to do it. And so I was just at a loss. I was like, there's nothing I can do. I've tried everything. I am mentally drained because of this food noise that is 24/7, and I'm always having to obsess over what is going in my body. I remember it was July of last year that I started Googling. I was like, I need help. I need help. I don't know if there's medication out there. I need somebody that specializes in this, that's going to understand that I'm trying, but I need help. And then that's when I found Sequence, and on my own, with no prompting. I hadn't even seen them on, TikTok or anything yet. I signed up to be a patient for Sequence, and I was started on medication back then, and I've been on it for over a year. And it was truthfully for me and my journey, best thing ever. Best thing ever.
Yes. So, yeah, what happened? Like, talk about the food noise and all that stuff.
Oh my gosh. So I it's so overwhelming to even think about, because I started taking medication, and it sounds so silly, but my body knew when it was hungry, my body knew when it was full, and when it wasn't hungry, I'm not thinking about food. I'm not thinking about you can't have this or you should have this. When I was hungry, my body started craving healthier options. So for me, it was amazing because I wasn't constantly thinking and feeling guilty for nourishing my body, which I know a lot of patients that struggle with obesity and dieting suffer from. They're obsessing over what they're eating and are they supposed to, and if they eat something that's, labeled bad, which, we shouldn't do, but if they have something that's labeled bad, then it's the guilt. And so my mental health has been so much better over the last year, physical health as well. But mental health, my mind is so clear, and I can start focusing on other things than, losing weight.
What about like you talk about the anxiety and almost feeling exhausted from the noise and like the constant, you know, trying
Hmm.
to choose healthier foods despite the strong cravings.
Hmm.
What did you get? Some people report getting tired. Some people notice energy changes. What, anything
Hmm.
there?
So I definitely saw my energy increase because
Yeah.
I'm on medication for anxiety and depression, which started, when I was young as well, from everything. I used to take 3 Xanax a day. I was
Mm.
taking 3 Xanax a day along with my antidepressant medication, which I still take my antidepressant, but I haven't taken a Xanax in months because I was
Amazing.
worrying and worrying. And I realized that's what I was worrying about, was my weight and whether or not I could or couldn't eat something, or what are people going to think, or, what am I doing to my body? And so when I started taking my medication from Sequence, my anxiety, do I still have it? Sometimes, but not related to that food noise that we talk about. And so it has helped energize me. It has helped, like I said, physically and mentally. It's been great.
I love hearing that. That's why I've heard that so many times. So
Mhm.
here's another thing. An article came out talking about how most people stop these medicines within a year. I don't know if you saw this article. And people are like, oh, it's because they're not losing as much weight, blah, 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 blah. But I've noticed that, first of all, we talk about hypo and hyper responders.
Mhm.
Hyper
Mhm.
responders, they go on a low dose and they just lose more than the average amount of weight that is seen in the trials.
Right.
Hypo responders, they can crank all the way up and they maybe lose 5% of their weight, which
Mhm.
is well below the average. There are some people though that have a hypo responders to weight, but they respond well from the food noise and anxiety that they're like, my quality of life is so much better right now.
Mhm.
I don't want to stop. I don't care that I didn't lose much weight on it. So if you like, if I don't even know how much weight you lost, I don't even, it doesn't even really matter. But if you, let's say you didn't lose any weight, but you had these other benefits. What would you like? Would you say the benefits outweigh the cons of the expense and all that stuff? Because it sounds like without taking the Xanax, that's impressive.
Right. Yeah, I think that's a really good question. And that's something that kind of puts it into perspective that every patient's going to have a different experience.
Yeah.
For me personally, I would say I'm probably more on the hypo responder side, being
Mm-hmm.
on it for a year. I'm very happy with the progress I've made and I feel amazing. For me, if I never lost another pound, I would still continue the medication
Yeah.
just based on how it has helped me mentally, because that is a sense of peace that I have not had, that I can't remember having,
It's
even in
so
my.
interesting.
Hmm.
I There needs to be more qualitative research as opposed to these headlines that are like, yeah, most people stop these. I'm like, I don't know. Like,
Right.
we're doing research on this. It's one of the things I
Mhm.
just emailed our science team about it. But your story, along with many of other patients, like I'm like, yeah, 5 to 10% weight loss. Well, I didn't lose the expected 20% or whatever. It's like, but no, but most of these patients are like, I don't want to stop it. Don't ever stop this medicine. It's made my life so much better. So it's really cool to hear you explain it in your own words there.
Yeah. And I think
Um,
that goes back to putting obesity as a disease.
mhm.
We wouldn't stop our blood pressure medicine or our cholesterol medicine. So,
Yeah, you're improved. Like you've improved. We're talking about this kind of concept of like weight health. So you've improved your health and quality of life, even without as much of what people say this like this clinically amount of weight loss. So it's these medicines are helping that kind of disease process of obesity. So that's interesting. Really cool to hear. If
yeah.
so, what about your TikTok? What do you talk about on your TikTok all often?
So, my TikTok started in the midst of the pandemic when I was finishing grad school and working as a COVID nurse. And so I just started posting things that made me laugh and things that made me
Yeah.
smile. And that's just, people started resonating with it. And so, as my platform got bigger and bigger, yes, I still post some comedy, but I take it as now I have a little bit of a platform and I want to use that to advocate for, patients that have suffered from mental illness or obese patients that aren't getting the care that they need, because I think those are two of the areas that we struggle when it comes to care. And there's so many awesome advocates out there that I've been able to work with or be introduced to. So now I kind of use it more as, yeah, there's a little bit of comedy here and there, but it's meant to be educational to a lot of nursing students. That's a lot of who follows my content. And so I think that is where we need to start, is with medical students and nursing students, on kind of, this is how we should be treating our patients in the future.
I think we're going to see a shift. The old guards retiring. I hate saying that, but like, it's true.
Yeah.
They're retiring, but some of those, it's hard to teach an old dog new tricks
Mhm.
sometimes. Well, not sometimes, a lot of times.
Yeah.
And I think what we're going to see is, oh, you millennials don't know what you're doing. I think we're going to see a shift of the paradigm shift really of understanding the stigma and bias. It's not going to be overnight, but I think
Yeah.
as older doctors who just weren't taught a certain way and maybe didn't have the social, I think social media it's a double-edged sword. We see horrible stuff on social media, but then it also helps teach people. So I think you're part of this shift to help nursing students and nurse practitioners and other clinicians and practitioners kind of see this different side of it and be like, I don't want to be like that clinician, the bad clinician. I want to be the good one. So I think it's really important. I think that's great what you're doing on your social
Thank you.
media. So thank you again.
Yeah, of course. Thank you.
Anything you'd want anybody, like any patients out there, dealing with their weights that don't want to see it, anything you want to say to them who might be listening to this going, yeah, that resonates with me about
Yeah,
dealing with their weight, don't want to see a doctor, that type of thing.
absolutely. I think that it is very hard, and your feelings are valid if you think that I'm overweight, nobody's going to listen to me, because that is what history has shown you and that is what you've seen in your care. And first of all, I understand, because I was that patient and am that patient, but I also understand as a provider that there are so many of us out there that want you to feel better physically, mentally, emotionally. And so It may take a couple providers, it may take a couple trial and errors, but there's going to be someone out there for you that will be the right fit. There are so many obesity medicine specialists and so many family medicine providers that want to promote your health. And so I know it's discouraging and I know it can be traumatizing when you've been told that, you're obese and that's the problem your entire life. But there's going to be someone out there that wants to help you. And having been that patient for the last 16 years, it took 16 years to find the right person and the right treatment plan. And so it can be discouraging, but definitely don't give up, because then you won't feel better ever. And so try to find the
Perfect.
right doctor, the right treatment. And remember, it's your journey, it's nobody else's. Just because this is mine and this worked for me doesn't mean that it's going to be the exact answer for somebody else.
That's great advice. Thank you so much for coming on the
Yeah.
podcast and sharing your story.
Yeah. Thank you so much for having me and for everything that you do for the obesity medicine population.
Thank you. We'll have to have you on again sometime.
Yes, absolutely.